ممكن نستنى 5 دقايق بس لما نوصل على الأقل نص عدد الحضور. أهلا وسهلا فيكم معنا. So 12:15 we're going to start إن شاء الله. 12 and 5 minutes we're going to start بحول الله.
السلام عليكم ورحمة الله وبركاته. مرحبا بالمشاركين، مرحبا سعادة الدكتورة خلود بنت عبد الرحمن الصفياني. دكتورة خلود هي استشاري عناية مركزة أطفال، رئيس لجنة الحماية من العنف والإيذاء في جامعة الملك عبد العزيز. ونشوف من الناس كانوا المشاركين معنا في الكلينيكال سكيل بالمحاضرة القيمة بإذن الله. مرحبا بك دكتورة خلود، حياك الله معنا. you can to start 12:05 minutes صح؟
Yes, just we can start by 12:05 to allow the others to join us. For any 3 minutes more. 3 دقايق كمان زيادة. Okay, السلام عليكم. Thank you أستاذة فاطمة. Thank you للحضور. First of all, I'm Dr. Khouloud الصفياني. I'm pediatric intensivist and pediatrician, associate professor at King Abdulaziz University College of Medicine. I have been worked for years for the undergraduate teaching, developed and conducting simulation for the undergraduate education. I have been participated for the many presentations, local and international, nationally and internationally, and as well simulation starter and developmental and initiative and program designer. Currently, I'm a member of the scientific board in the Pediatric Intensive Care Fellowship at the Kingdom, at the level of the Kingdom. Today, I will be talking to you about the medical simulation research as an experience, pediatric researchers' experience in the simulation education. It will take this presentation from 40 minutes to 60 minutes, and we will go all through the objectives and all content. First of all, I would like from every one of you to introduce him or herself in the chat room, please, before going through the content of this topic. هل صوتي واضح للجميع؟ اوكي طيب. Okay. So, first of all, we're going to talk about the introduction, literature review, some implementation and the strategies, result and conclusion, as well a summary. So, we start with introduction. As you know, simulation is an structural process that substitutes real patient encounters with artificial models, live actors, and virtual reality patients. Simulation-based learning has been proven to be a cost-effective, easily accessible, and promising educational method in the modern education. It allows deliberated practice and guided reflection, and provides a safe environment for teaching and practicing technical skills. It was associated with higher learning outcomes when compared with other instructional modalities. So the medical simulation is being used with increasing frequency in postgraduate medical education, and that's due to its efficacy in helping learners to achieve skill competencies. We have here two previously Saudi studies were found to report the usage of simulator for teaching laparoscopic surgery skills and local anesthetic approaches, and they showed that significantly enhancement of both cognitive and psychomotor student skills achieved by the simulation. So for the literature review, Joseph observed that the favorable perception towards the simulation-based learning was significantly higher among female Indian, fourth and the sixth medical student, with a significant high p value. One study was conducted to evaluate medical student satisfaction with the simulation-based education and learning at the College of Medicine, King Abdulaziz King Saud bin Abdulaziz University for Health Science, Riyadh. And it was noticed that the female third-year medical students were with a significant p-value satisfied with the simulation-based learning when it compared with the female. Brandwa reported that the undergraduate medical course at Brazil used a high-fidelity simulation associated with the audiovisual resources in cardiology, trauma care, and pediatrics were accepted by students, and this training strategy during the clerkship, and they felt secure in learning environment. DODAS provided an evidence supporting the use of the simulation-based learning, teaching and learning methods for undergraduate over the traditional methods for medical student education. And they reported an improvement in the reaction, learning, and behavior of the student who received a series of simulation-based skills building workshop within the pediatric clerkship for more than 2 years. For the Canadian investigators, they utilized a self-built femoral vein simulator to teach pediatric femoral vein catheterization to pediatric and emergency medicine residents. It was reported that a resident who underwent training with the simulator had a significantly higher mean confidence level for femoral vein catheterization than those residents who received didactic teaching alone. So we have actually limited data on the impact of simulation on medical students' satisfaction during their pediatric clerkship. Nevertheless, no enough studies have investigated if there is a gender-based differences in the student satisfaction with the simulation in pediatrics. So for that reason, the author thought of assessing the perception of the undergraduate medical student at King Abdulaziz University, Faculty of Medicine, in the clinical skills and simulation centers towards simulation-based learning in pediatric clerkship, and if the gender affects their perception. After being ethically accepted from the Research Ethics Committee at the Faculty of Medicine, KUH Jeddah, we conducted a retrospective comparative cross-sectional study during the academic year 2017 and 2018 at the Clinical Skill and Simulation Center, CSSC, at the KU Hospital Jeddah, and a standardized self-administered questionnaires designed to evaluate the simulation-based session conducted at the CSSC, and it was distributed to almost 256 for fifth-year medical students enrolled in the pediatric rotation and attended the simulation session, 12 students per session weekly over 16 weeks. The questionnaire was included 3 sections aimed to assess student perception of CSSC facilities, as well as the student's perception of simulation experience before, during, and after the session, and introductory section with the questions asking about the information of the session and the student. We use a 7-point Likert scale was used to grade the student response, ranged from strongly disagree to strongly agreed. So continuing the methodology, we have a pre-simulation session, simulation session, and the end of the simulation session. For the pre-simulation session, which is 24 hours before starting our simulation, we use the flipped classroom. Each group of the students received reading material as a PowerPoint presentation for the simulated topic every week, and welcoming letter as well, explaining for them the fidelity mannequin. Then after that simulation session, at the day of the simulation, the student will be distributed into 2 teams with the maximum of 1 instructor to the students. And then we went through briefing, including basic assumption, fiction contrast, contract and agreement on the confidentiality, participation, and respect. And during this case scenario, we observed team structures, we observed task management and decision making. We observed as well leadership, teamwork, communication, and situation orientation. The decision was aimed as well to enable the student to perform the psychomotor technical skills for such as attaching and adding the cardiac monitor, adding pulse oximeters, attach the pulse oximeter, providing oxygen to the mannequin, and inserting peripheral line. At the end, debriefing. So at the end of the simulation session, all the students will sit for a post-simulation session, summary, feedback, evaluation, and perception, and they are filling the questionnaires. So the result the data were collected from 256 students, which showed 125 male and 131 female students. The student perception about the CSSC learning environment and teaching aids availability, the female students were showed significantly more satisfied with the learning environment and the orientation about the simulation environment and the clarity of the session objectives than male. On the other hand, both male and female were satisfied with the simulation technology with no significant statistically different between them. Regarding students' perception about the pre-simulation session, orientation found that all students were satisfied. Female students were significantly with a significant B value, more satisfied than male, although the female students were also more satisfied with the clarity of the simulation session objectives. However, no significant difference between them. Regarding student perception during simulation session, the female students believed the simulation session significantly with a significant p-value helped them to apply the knowledge and the skills they needed for clinical practice more than male students, and the female were more satisfied than male regarding the chance to practice the instructor competency, the objectives and equipment utilized during the simulation session, although the difference between them was not statistically significant. Regarding students' perception about the post-simulation session, they were very satisfied with the program organization, with no significant difference between male and female. On the other hand, there was significantly high satisfaction among the female students with the impact of debriefing on their ability to recognize the appropriate intervention with a significant B value and to share their ideas and thoughts about the different situations with a significant B value as well. And they stated that they would recommend attending such a session to their colleague. The female were more satisfied than male regarding the chance to practice the instructor competency, objectives, equipment, utilization of the simulation as well. These tables of the result that mentioned just before. So, in conclusion and recommendation, use of simulation-based learning was well perceived by the fifth-year medical student. Face validity of simulation by female. Medical student was evidenced in this study as they were more satisfied with the simulation experience and have a significant higher positive attitude towards simulation-based learning compared to male. It needs to be integrated in the 5th-year medical student curricula, and further researchers are recommended to explore methods to maximize the benefits of simulation, especially to improve retention of the knowledge and the skills for the students. So by this slide, I conclude and finished my presentation. Thank you for your attendance. Thank you for your listening. And now the stage open for you to clarify and to answer your questions. Okay. You are welcome to ask any question, please. Okay. طيب هل anyone عنده أي سؤال أي استفسار? So we're going to start answering the questions regarding this topic. So please, if you have any answer, any queries need to be clarified, answer need to be questions need to be answered. So the stage for you, please mute yourself, unmute yourself, and you can ask